Dr. Mark Fesler. I'm a hematologist-oncologist at St. Luke's Center for Cancer Care. I chose to specialize in hematology-oncology for several reasons. One, it's an anxiety-provoking illness, and I felt like my vocation and calling was to help people with an anxiety-provoking illness. The second reason I chose oncology is the rapid developments in the field. So research developments have been rather robust in the field, and I'm able to offer patients increasingly novel therapies to help treat their cancer, and the survival for cancers improved accordingly. It's a holistic care philosophy. I believe that as a medical oncologist, I'm the quarterback of a patient's care journey for blood cancer, and I elicit help from multiple people in that care journey. So the patient's caregivers, their family members, the nurses on my blood cancer team, as well as specialists, other doctors, physical therapists, social workers, pharmacists, who are all part of the team and helping taking care of the patient. So that whole team helps to create a good care product for the patient. Hematology-oncology is a rather vast field. I tend to specialize in blood cancers. So the main blood cancers that I see patients for, and I see adult patients, not pediatric patients, would be leukemias, lymphomas, multiple myeloma, and then myelodysplastic and myeloproliferative disorders. I'm really excited to be part of the St. Luke's cancer team. I think that the increased attention to subspecialization in the field has really come into play over the last several years, given all the developments in oncology. In blood cancer alone, about 5 to 10 new agents to treat blood cancers becomes FDA approved each year. And so patients can expect increasingly improved outcomes. With that becomes that specialization of the provider becomes really important to make those care decisions along the patient's journey. So I'm really excited to be a part of the team here and increase the specialization that St. Luke's has to offer cancer patients. I was educated at St. Luke's University with a BA in biology. I then went on to medical school at St. Luke's University, and I did an internship residency at the University Health Science Center in Colorado. I came back for fellowship to St. Luke's University and completed that. I've been on faculty at St. Luke's University for 11 years, and I've transitioned to St. Luke's Center for Cancer Care this past year. I tend to specialize in blood cancers. So the main blood cancers that I see patients for, and I see adult patients, not pediatric patients, would be leukemias, lymphomas, multiple myeloma, and then myelodysplastic and myeloproliferative disorders. So those are the main categories of diseases that fall into blood cancer. The blood cancer field's rapidly evolving, both in terms of how we diagnose blood cancers and how we treat blood cancers. So the diagnostic tools that we have are increasingly improving to detect disease at a very low level, primarily in the blood, but also in the tissue. The way that we treat blood cancer continues to evolve and improve. So we used to use just chemotherapy and radiation, but now we've got a whole battery of additional treatments that attack the cancer cells more specifically. They might target specific mutations within the cancer cells, and then also the broad field of immunotherapies moving into the cancer field increasingly as well. Immunotherapy is basically any treatment that stimulates a patient's own immune system to help attack the cancer. Typically it's done as an IV infusion format, but immunotherapies, there's some oral treatments as well available from an immunotherapy perspective. Clinical trials are the way that we move the field forward in oncology. Patient enrollment on clinical trials is important to advance the field, and patients sometimes can receive therapies they wouldn't otherwise receive as part of standard treatment on a clinical trial. The immune therapies that I'm excited about are something called bispecific antibodies. These are antibodies that bring the cancer cell in close proximity to the immune system, and I'm planning on offering immunotherapy with bispecific trials here at St. Luke's to try to help patients in their cancer journey. These bispecific antibody trials could be for lymphoma, they could be for leukemia, they could be for myeloma, and specifically they might offset the need for chemotherapy, both in terms of frontline treatment, but then also potentially help the disease when there's no other treatment options that exist, when the disease has come back or been relapsed or refractory. Blood cancers typically aren't directly inherited from one individual to another. So some diseases are maybe a 50-50 chance or a 25% of being genetically transmitted from parents to offspring. Blood cancers typically are not like that. Blood cancers, a first-degree relative may have a slightly increased risk of getting, let's say, lymphoma or leukemia, but it's typically not a dramatic increase in the incidence of the disease. So typically screening procedures for offspring of parents with a blood cancer, it's not recommended to get regular screening tests. I do recommend that any patient get a yearly blood count with their primary care physician just to keep an eye on what their normal levels of blood values are. But typically there's not screening procedures for blood cancers per se. Cutaneous lymphomas are a complex disease that usually involves the skin. Sometimes they involve the lymph nodes, sometimes they involve the bloodstream. And it becomes important to have collaboration with other specialists, and it can be important to have collaboration right at the same visit for patients to optimize their convenience and their care plans right at the same point of contact. So Dr. Yadira Hurley, who's a dermatopathologist at SLU Care, and I are collaborating to do a cutaneous lymphoma clinic here at St. Luke's. We'll be seeing patients the last Friday every month in the morning. We'll see patients together in that clinic and then develop care plans accordingly for patients with cutaneous lymphomas. The reputation of the hospital is just fantastic. I'm a St. Louis person and born and raised, and so that was one of the big factors in deciding on St. Luke's, is just the reputation of the hospital. And then the cancer center, just such a warm, welcome environment of people. I think that it really could identify it as a place where I could really transition some of my existing patients and take on new patients and really take excellent care of them. I'm a St. Louis born and raised person. I'm a hockey fan, and so I bleed blue for the Blues.